Carla Jimena Contreras has been a nurse working in Colombia's healthcare system for the past 7 years. Through the pandemic, she's been visiting high-risk patients in their homes to administer traditional vaccines for flu and other diseases. Now she's getting ready to inoculate patients against COVID-19, with the country's vaccine rollout set to begin in 2 weeks by taking a course to prepare for what's to come.
There are a lot of patients who ask us about the vaccine because there is a lot of misinformation in places like social media, and it's not the truth of the vaccine. As the first line of responders, informing the people is part of that work.
Colombia's Ministry of Health is partnering with the National Learning Service, known by its acronym SENA, to provide training to doctors, nurses, dentists, and other health professionals. The response has been positive, according to course administrators, with more than 71,000 Colombians in the healthcare sector registered and approved for the first round of courses. The biggest challenge is time, getting them all trained over the next 3 months. A maximum of 40 healthcare workers are teamed up with a professor to receive instructions. The training takes place online with up to 48 hours worth of classes, giving health professionals what SENA says is the information they need to know about the vaccines and the measures in place to administer them safely.
The government is not only making great efforts to have doses of the vaccine for the population, but there also has to be preparation of the people in the health sector and protocols in place.
For Contreras, being part of a team that will administer vaccines is a responsibility she doesn't take lightly. She knows the heartache of losing a loved one to COVID-19 and says doing her part to prevent further losses is important.
It is satisfying to be able to provide a beacon of hope that we can help our patients feel a little bit safer. There might still be a threat, but with the vaccine, they might feel a little safer going out on the street, and that is satisfying.
Michelle Begue, CGTN, Bogotá, Colombia.